Good evening, everyone. It's my great pleasure to welcome you to our program today. Thank you so much for your interest and for being here. I will be introducing tonight's featured speaker and moderating the question and answer period. But before I turn things over to Dr. Sarah Patterson, let me briefly introduce myself and provide some background about this educational series. My name is Sarah Goglin, and I have been a faculty member in the Rheumatology division at UCSF since 2015, after completing my in residency and rheumatology fellowship training here. For the past 2 years, I've been the Associate Chief of Education in our division. And in this role, I have the opportunity to work with the Russell Engelman Board, which consists of dedicated volunteers who help to support rheumatology research and education at UCSF. Last year, the board and the rheumatology faculty made a commitment to provide free educational programs for patients with rheumatic diseases, their families and friends, as well as many others who support our work. To date, our programs have focused on the impact of COVID-19 on patients with rheumatic and immunologic diseases and osteoarthritis. Today, we will take on nutrition and lifestyle with the help of Dr. Patterson. Tonight's session is entitled Leveraging Nutrition and Lifestyle to Improve Outcomes in Rheumatic Disease, and our speaker is Dr. Sarah Patterson. Dr. Patterson received her undergraduate degree from UC Berkeley and her MD from UCSF. She completed her postdoctoral training at UCSF, including internal medicine residency, rheumatology fellowship, and an NIH-funded postdoctoral fellowship in integrative medicine research. She currently holds a joint faculty position in the divisions of rheumatology and the Osher Center for Integrative Health. As a rheumatologist, she specializes in integrative treatment approaches for managing systemic rheumatic conditions, and she practices in the UCSF Health Rheumatology and Osher Center clinics. Her scholarship is funded by the NIH and focuses on defining how lifestyle behaviors and non-pharmacologic interventions impact disease outcomes among people with rheumatoid arthritis and systemic lupus. Just a couple of housekeeping things before she gets started. During the presentation, I encourage you to submit questions via the question and answer function on your screen, and we will try to get to as many as we can during the last 20 minutes or so of this hour. Please don't try to use the chat function, as I believe it's been disabled for this program. The program is being recorded, but only Dr. Patterson and I will be seen or identified in the recording. Now I will turn it over to Dr. Patterson to share her screen and get us started. Over to you, Dr. Patterson. Thanks.
Thank you, Dr. Goglin, for that kind introduction. So I want to start by giving a little background on what integrative rheumatology is and why I've been motivated to pursue a career at the intersection of integrative medicine and rheumatology. So really the main reason I was motivated to pursue this field is because as many people in this audience will know, people with systemic rheumatic diseases often experience a high burden of disease-related symptoms, and these symptoms can be refractory to some of our best medications. So for example, among patients with rheumatoid arthritis and systemic lupus, even among people who are on the best possible medicines that we have, many continue to experience symptoms like pain, fatigue, and sleep disturbance. And furthermore, we're often able to mitigate some of these refractory symptoms via lifestyle changes and integrative medicine treatment approaches. Another reason for pursuing this field of integrative rheumatology is because I think it's really important to patients, and there's a high level of interest in complementary and integrative medicine among rheumatology patients. As an example, this is an old survey from 1999, but they found in this survey that among US adults with a rheumatic condition, 2/3 had used complementary and integrative medicine at one point, and 56% were actively using a treatment modality that fell into the realm of complementary and integrative medicine to manage their condition. And just a couple definitions before we move on. So what exactly is integrative medicine? There's a bunch of definitions out there, and I'm including a couple definitions that I like. So one definition is that it emphasizes the therapeutic relationship between practitioner and patient, that it's informed by evidence, and that it makes use of all of the appropriate therapies. It's also been described as a healing-oriented medicine that takes account of the whole person, including all aspects of their lifestyle. And this is a diagram from the National Center for Complementary and Integrative Health that I really like, that I think gives an even better representation of what integrative medicine is. And so, complementary medicine is a diverse collection of healthcare systems, practices, and products that are generally considered outside of conventional medicine, which focuses on evidence-based prescription medications, often in procedures. And then lifestyle medicine focuses on behavioral interventions to prevent and manage chronic illnesses. And so the way that I think about it, and that most people in the field are conceptualizing integrative health, is that it's really in the middle of this Venn diagram. And most importantly, I want to emphasize that integrative medicine is the use of complementary approaches and lifestyle medicine in combination with conventional medicine, not in opposition to it. So let's go ahead and get started with a patient. This is a really common patient question that I get all the time. So this is a woman I saw in my clinic. She's a 35-year-old woman who has a recent diagnosis of rheumatoid arthritis, for which she was started on methotrexate. And since we started the methotrexate, her arthritis is improving, but she's still experiencing a fair amount of fatigue. And she comes to me noting that she really feels motivated to clean up her diet. However, she's overwhelmed by the conflicting guidance that she's receiving on the internet. And her question for me was, what would be the best diet for someone like her with rheumatoid arthritis? So some general nutrition advice that I give to people with rheumatic diseases is, first of all, that patients who feel better with dietary changes are generally modifying their diet in addition to continuing with their standard medical treatments and medications. I also like to emphasize that there's no single magic bullet autoimmune diet or anti-inflammatory diet, that it's really important to work with a professional to develop an individualized diet that makes sense based on that person's culture, dietary preferences, and any food sensitivities they may have. And that there is randomized controlled trial data on certain dietary patterns and food ingredients that we can use to guide us in developing an optimal diet. And I will note that most of these studies have been done in people with rheumatoid arthritis. So I'll be focusing mostly on dietary recommendations for RA specifically. So with that said, let's talk about one of the studies. This was a trial of a Mediterranean diet for people with RA. And what they did was they randomized people into a group where they were on a Mediterranean type diet or just continuing their regular diet. And they were on that diet for about 3 months. The Mediterranean type diet was included olive oil, green vegetables, root vegetables, fruits, low-fat dairy, green tea, black tea, and lean poultry. And this graph here shows what the results from the study. The line here represented with the filled in black dots are the people who were in the Mediterranean diet group. And I should also note that everybody in this trial was already on stable disease modifying anti-rheumatic drugs. And then they simply went into the Mediterranean diet group or continued on their regular diet. And among the people who went into the Mediterranean diet group, after 12 weeks of the study, they had a significant reduction in their disease activity, which was measured with this tool called the disease activity score in 28 joints, compared to the people in the control group, suggesting that a Mediterranean diet might be an appropriate complementary approach for people with RA. And then I get a lot of questions from patients and colleagues about the utility of an elimination diet. So I will share with you really the one study we have that looked at an elimination diet. This was a trial that put people into a specialized diet group that involved 3 different phases. So in the first phase of the diet, they were fasting. In the second phase of the diet, they were eating a vegan gluten-free diet for 3 months. And then during the final 9 months of this study, they were on a vegetarian diet, but they could go back to eating gluten and they could also add back in lactose. So it was this kind of 3-phase diet that, and what they did as well as they were liberalizing the diet over the year-long study was they would work with a registered dietitian to determine whether patients were developing food sensitivities or worse symptoms from their RA as they liberalized the diet. And then if they were identifying food sensitivities, those foods would be eliminated. So everyone in this very specialized diet was compared against a control group who were on kind of a well-balanced but less restrictive diet. And patients in the diet group, the results were that the people who were on the specialized diet did have a significant improvement in indices of RA disease activity. So specifically, they had less tender joints, less swollen joints, lower inflammatory markers, and less pain. And this was first appreciated at the very first assessment after 1 month. And then what was really interesting, and I think helpful in terms of thinking about, what were the most active components of this dietary intervention, is that everyone was able to sustain those benefits over the 13-month course of the study. And I'm going to share one more trial. This was a study that was done in Sweden shortly after that trial I just shared. And the investigators for this study wanted to know whether eating a vegan gluten-free diet would improve disease activity among people with rheumatoid arthritis. So pretty similar to the study I just showed, except that in this study, everyone stayed on the vegan gluten-free diet for an entire year. And the people in the vegan gluten-free diet were compared against a control group who were simply taking a well-balanced diet. And after 1 year, what they noticed was that the vegan group had an improvement in disease activity, similar to that last study. And the way that they measured it in this study was with something called the ACR 20 criteria, which requires an improvement by at least 20% in the number of tender and swollen joints. So there were 34% of the vegan group were able to achieve this ACR 20 criteria compared to only 4% in the non-vegan group, suggesting that this pretty restrictive vegan gluten-free diet was helpful for joint inflammation. However, at the end of the trial, they did not notice any difference in damage in the joints on the x-rays. And the other important caveat of this study is that I think it was very difficult for people to adhere to this restrictive diet for an entire year, because 42% of people in the vegan diet did drop out of the study compared to only 11% who were eating the well-balanced diet. So with that intro with a couple of studies, let's get back to my patient's question about what she should be eating. This is a version of an anti-inflammatory diet that I've put together working with several colleagues at other institutions as a tool to provide guidance for people who ask this question. And so we'll just kind of go through the different features of this anti-inflammatory diet food pyramid. So I think the critical piece of any anti-inflammatory or healthy diet at all is that it's plant-based, meaning that it really emphasizes an abundance of colorful, non-starchy vegetables, and that forms the foundation of the diet. A second feature of this diet is that there is a lot of low glycemic, high fiber carbohydrates. And one of the benefits of low glycemic, high fiber carbohydrates is that fiber actually, in addition to improving glycemic control, meaning we don't have as big of spikes in blood sugar after a meal, it also serves as something called a prebiotic, meaning that it supports the beneficial bacteria that live in our gut and helps us to have better gut health. And additionally, soluble fiber is actually transformed via fermentation by gut bacteria into something called short chain fatty acids. And these short chain fatty acids, there's kind of a growing appreciation for their health benefits because they can act both locally in the gut where they're produced, as well as in systemic circulation to impart anti-inflammatory effects. And because of this kind of growing focus on the importance of short chain fatty acids, there was a recent study in 2020 by a group that specifically looked at the effect of eating a high fiber diet on people with rheumatoid arthritis to see if it influenced their systemic inflammatory markers. And so they put 36 people on a really high fiber diet for 28 days, and they collected blood and stool, both at the beginning of the study and then at the end of the month. And these graphs that are at the top of the slide show that over the course of that month, eating this high fiber diet did in fact, as they predicted, increase the concentration of short chain fatty acids in their blood. And I think even more importantly, there was a direct association between this increase in short chain fatty acids during the duration of being on the high fiber diet with a decrease in inflammatory molecules. So specifically, they saw that there was a decrease in this chemokine called MCP1, and there were decreases in a couple of cytokines that are inflammatory called IL-18 and IL-33. So they didn't measure some of the clinical outcomes that we're really interested in monitoring over time in people with rheumatoid arthritis, but I think there's this just points to one of the mechanisms by which eating a diet that's plant-based with high fiber, low glycemic index carbohydrates improves overall health. So back to the pyramid, the third feature I want to highlight is that it really includes an emphasis on protein from plants and fish. And I've included in this pyramid some examples of vegetarian sources of protein, which include beans, lentils, nuts, seeds, and tofu. And I also just want to note that there's more and more studies in the general population and epidemiologic studies showing a mortality benefit among people who eat either a pescatarian diet or a vegetarian diet. So let's next talk about this concept of healthy fats. You'll notice that the third row in the pyramid includes healthy oils and fats and fish, which are a source of healthy fats. And so why are we talking about fat? Well, one of the reasons is because we know that the balance of polyunsaturated fatty acids in the diet affects human health and it affects immune function. And unfortunately, the standard American diet, which some people call the SAD diet, has this relative abundance of omega-6 polyunsaturated fatty acids compared to omega-3 polyunsaturated fatty acids. And this modern Western diet or SAD diet has actually been linked to a number of adverse health outcomes. This is a little bit of a busy slide, but I think the point to emphasize here is that the types of fatty acids that we eat in our diet do influence the kinds of molecules called eicosanoids that we make in our body, which then influence a number of really important and relevant molecules in the immune system. So for example, when there's this shift, as we see in the SAD diet, toward more omega-6s from processed and fried foods, there's more of this molecule called arachidonic acid, and then more of these pro-thrombotic and pro-inflammatory molecules. But on a practical level, for those of us who are motivated to eat more omega-3s and kind of shift that balance back in a better direction, I wanted to list some of the sources of healthy fats. So healthy fats are rich in either monounsaturated or omega-3 polyunsaturated fatty acids. And a good source of omega-3s is nuts, especially walnuts, and a number of different seeds like hemp seeds, flax seeds, and chia seeds, as well as cold water fatty fish like wild salmon. And then in terms of monounsaturated fatty acids, extra virgin olive oil and avocado are great ways to eat more of those. And since we're talking about healthy fats, I think it's important to acknowledge that some people choose to increase the amount of omega-3 fatty acids they're getting by taking a supplement. I think one of the reasons people do this is because it can be hard to get maybe enough omega-3s from diet alone if you're really trying to achieve a therapeutic effect that you would notice, for example, in your joints. And as an example, the dose of omega-3s that has been tested in trials of fish oil for people with rheumatoid arthritis was 2 to 9 grams, or 2,000 to 9,000 milligrams per day. Whereas eating one serving of salmon is only about a gram of omega-3s. So with that intro, I'll talk for a minute about fish oil supplements. There was a study that looked at whether fish oil could be used as an adjuvant therapy, meaning in addition to regular prescription medications, to improve disease activity in people with rheumatoid arthritis. I think this was a well-designed study because they compared taking high-dose fish oil with taking low-dose fish oil instead of having a pure placebo group, which makes sense because people know when they're taking fish oil because you can tell. And then these were the results. So the treatment group that was taking fish oil in addition to their medicines is represented with this dashed line, whereas the control group is in the solid black line. And the outcome they were most interested in was the ability to achieve disease remission after a year. And among the people who took that fish oil supplement with all of their medicines, they had a 2 times increased probability of achieving remission, suggesting that, perhaps fish oil is a reasonable approach for some people. And then there's been some kind of mixed data looking at whether omega-3 supplements are helpful in lupus. It might be helpful for improving disease activity but it's only been tested in people with low disease activity. And the benefits that were perceived were short-term, and they had to do with rashes and neuromotor symptoms. So getting back to the food pyramid, the final thing I'll mention that's at the top of the food pyramid is this recommendation to flavor food with anti-inflammatory spices and herbs. And so when we're talking about anti-inflammatory spices, of course, we have to talk about turmeric and curcumin. And I want to acknowledge that turmeric has a very long history of medicinal usage in South Asia. And curcumin is the yellow covered primary active constituent in the turmeric plant. And a lot of people have looked at kind of the effect that curcumin has in a test tube. And what they've noticed is that it decreases activation of a couple of genes, for example, STAT1 and STAT3. And in doing that, it reduces expression of some other inflammatory molecules like IL-6, which is an inflammatory cytokine, suggesting that there is some kind of biologic plausibility for why turmeric would have anti-inflammatory properties. Turmeric has a really low absorption from the gut into the blood, but combining it with black pepper increases absorption. And so does this really work for RA? Unfortunately, I'd say that the jury is probably still out because we don't have big enough studies to be able to provide a really confident answer, but I'll show you the studies that we do have. So this was a study that had 3 different groups of people with rheumatoid arthritis, and they were given either low-dose turmeric, high-dose turmeric or placebo, and they followed them for 3 months. And then they reported on what happened to the participants in the study with respect to their rheumatoid arthritis disease activity. And they found that the disease activity improved in both of the turmeric groups, whereas it stayed the same in the placebo group. I think this study definitely has some risk of bias, because there's a good chance that people who were taking the turmeric knew that they were taking it. But it is some kind of preliminary evidence that turmeric may be helpful for RA. And this is the one other study looking at the impact of turmeric in people with rheumatoid arthritis. And this one was a little different, because instead of comparing turmeric or curcumin to a placebo group, they compared it to taking a non-steroidal anti-inflammatory drug called diclofenac, which is really similar to ibuprofen. And what they found with this study was that that everyone improved, regardless of which treatment group they were in, and that the improvement was pretty similar, suggesting that among people who decide to take turmeric or curcumin supplement as a complementary treatment for their RA, the amount of benefit they could expect to see would be kind of similar to taking a full dose ibuprofen every day. So as I mentioned, I think we do still need more studies on this, since we so far only have 2 small randomized controlled trials looking at the efficacy of turmeric and curcumin for rheumatoid arthritis, and they both had a high risk of bias. There has been a little bit more research focusing on whether turmeric and curcumin are helpful among people with osteoarthritis. So I'll just mention this one meta-analysis, which was a combination, which basically combined all of the results from 8 different studies that tested whether curcumin was more helpful than placebo for improving pain in people with wear and tear arthritis. And this little diamond at the bottom of this graph shows that there was a statistically significant suggestion of an improvement in pain among people who took the curcumin compared to placebo. Though it was a relatively small, it wasn't a huge benefit, but there was a benefit. Again, this was for people with the wear and tear osteoarthritis. And in case anyone here is thinking about, going on Amazon and buying a curcumin supplement, I just want to note that there's a few things to think about with respect to safety. The most common side effect is that people can get abdominal upset. There's also some, when they've looked at the impact of curcumin in a test tube, it looks like it has a blood thinning effect. So I usually tell people to stop taking it if they're going to have a procedure done. And also be aware that it can reduce blood sugar levels, which is one of the reasons that it's used by some people with diabetes. And please tell your doctor if you're going to think about adding this as a supplement, because it does have many potential drug interactions. And then, just for the sake of time, I'm going to go more quickly through the rest of the slides, but wanted to note that there have been some little studies that have looked at some other spices that have found improvement in rheumatoid arthritis disease activity among people who are taking high amounts of garlic, ginger, and cinnamon. So I think these are all really nice spices for all of us to include in our diet. In terms of how impactful they will be on disease outcomes in people with RA, I think we need to be cautious, because all of these studies were very small and they were all completed in only 2 countries, in Iran and India. So it'd be really helpful to do some bigger studies that include people from other places. And in terms of my take-home points that I hope everyone remembers from this discussion about nutrition, please remember that there's no single one-size-fits-all approach. that it's critical to eat a plant-based diet, which means lots of fresh and diverse vegetables and fruits. And one way to think about that is to have vegetables and fruits covering half your plate, at least for lunch and dinner. There's this emphasis on the low glycemic, high fiber carbohydrates, as well as healthy fats, which are fats that contain monounsaturated and omega-3 polyunsaturated fatty acids. Try to eat mostly vegetarian protein or fish. And then in terms of the things that I would minimize, it's really red meat, sugar, and highly processed flour. For those of you who want to learn more or read more, I can direct you to this website that I put together with a number of colleagues that covers even more information about nutrition. And I particularly recommend this website called Putting Nutrition to Practice, Tips for Making Dietary Changes, which I built in collaboration with Danica Cohen, who's a registered dietitian at the Osher Center. It includes a lot of just practical tips and recipes. Quick note about supplements, since we did speak about supplements briefly, is that it's really important if you are going to take a supplement to make sure you take one that has gone through some kind of third-party testing to ensure that it's high quality, because supplements can be marketed without any proof of safety or efficacy. And since we mostly focused on nutrition during this talk, I want to acknowledge that integrative medicine and lifestyle medicine is a broad field that includes addressing all the aspects of the way a person lives. And some of those pillars include physical activity, sleep and rest, stress resilience through mind-body medicine, and even spending time in nature. So in summary, integrative medicine is a field that takes account of the whole person. That a plant-based Mediterranean diet has been shown to be helpful among people with rheumatoid arthritis for reducing joint swelling. And that right now, in terms of supplements, there is some limited data that was positive to support using fish oil as an adjunctive treatment for rheumatoid arthritis and using curcumin to reduce pain in people with osteoarthritis. So with that, I will go ahead and turn it back to Dr. Godwin.
Thank you, Dr. Patterson, for that wonderful talk and for sharing your expertise about the impact and role of diet. We have some great questions that have come into the Q&A, and please feel free to continue to put questions in there. And Dr. Patterson and I will have a discussion about those over the next 20 minutes or so. So maybe I'll start with one of the first questions, which is specifically focusing on patients with ANCA vasculitis, but I think the question applies, kind of more broadly to thinking about different rheumatic diseases. And this person is wondering if there is any evidence or a role for the Mediterranean diet or other dietary changes in people that have diseases other than rheumatoid arthritis and lupus, which you've obviously spoken about today.
That's a really great question. And unfortunately, we don't have any randomized controlled trials yet, specifically for people with ANCA-associated vasculitis. So I think we have to extrapolate from the data that we have for other inflammatory conditions. I think since we have that study showing an improvement among people with rheumatoid arthritis, it suggests that it is helpful for immune-mediated inflammatory diseases. There's also been much larger trials in the general population showing benefits of the Mediterranean diet for reducing cardiovascular risk and mortality.
Great, thank you. Another question that's come through, thinking a little bit more specifically about diet and the anti-inflammatory pyramid that you shared, was if there are specific recommendations that you make in the vegetable arm for people to avoid nightshades. I know that's a question that I get asked a lot by my patients, or there are specific fruits and vegetables that they should try to include. How do you think about that, and how do you talk with your patients about that?
Yeah, that's a great question. Thank you for that question. So yeah, nightshades are controversial. I think the the rationale behind avoiding them among people who make that recommendation is that they contain a molecule called solanine, which is a glycoalkaloid that is thought to increase intestinal permeability. And so there have been studies, for example, in mice that have shown that this molecule solanine can kind of increase inflammation inside the gut. I should also note that nightshades include tomatoes, eggplants, and potatoes. So there's this kind of mouse model studies showing maybe some increased inflammation inside the gut. However, there hasn't been any research, any solid research showing that it worsens rheumatoid arthritis or lupus or systemic inflammation in the context of a systemic rheumatic disease. So for that reason, I do not recommend avoiding nightshades unless you know that you have an intolerance to them.
Great. And maybe, keeping in the same vein of foods to potentially avoid or not to avoid, how do you think about people who are interested in, trying to cut out specific foods, whether it be gluten-containing foods, dairy, or sugar? Is there a process by which you recommend they try those different things? Should they do it all at once and add things back, or do one at a time? What are your thoughts about that?
Yeah, great question as well. So what this process of kind of trying to identify specific foods that may be triggers for either bad digestive symptoms or even joint symptoms, for example, typically people work with a registered dietitian. And we'll start out with a diet that is similar to the second study that I presented in my presentation, where they go on to a very, very simple diet for a week or two. And then we'll slowly add back in one food at a time and usually give it a few days after adding each food to note whether there is any adverse symptoms that occur during that process of liberalizing the diet. I think this can be a little arduous, so it requires a fair amount of dedication. And again, I think it's really helpful to work with a registered dietitian during that process. That's something that our registered dietitian at the UCSF Osher Center does with many of her patients.
Great. There's a follow-up question about if you can give a bit more detail about what a high fiber diet is, and specifically like how many grams of fiber constitutes a high fiber diet if someone is really trying to make that change.
Yeah, that's a good question. So it's a little different. It depends on the total number of calories that a person is eating in a day, and the guidance is different for men and women. But usually it's at least 30 grams of fiber for women and 35 or 40 grams for men.
Great. And then another diet question related to dairy intake. Do you have specific recommendations, or is there any evidence that cow's milk is worse than something like oat milk, for example, or a soy milk product for patients with different rheumatic diseases?
Yeah, I think in terms of whether it's necessary to be lactose free, for example, or avoid dairy, that we don't have any studies showing that that's critical. I did present a couple of studies that showed that people who were on a vegan diet, which of course does not include dairy,
Sure.
had improvement in their disease activity. But I will also note that there are many health benefits of low-fat, sugar-free yogurt. So for example, that's a really nice source of probiotics. So I tend to, for my patients who do not have lactose intolerance, I think eating, non-fat or low-fat Greek yogurt is a really great way to get protein, as well as those healthy probiotics. And that the low-fat dairy was also part of the Mediterranean diet that showed benefit.
Great. Since you mentioned probiotics, I'll ask you this question from somebody wondering about gut biodiversity and its effect on inflammation. Is there anything that patients who are on a regular regimen of antibiotics, like on a sulfa antibiotic, for example, that they can do to improve their gut diversity and potentially have an impact on disease down the line?
Yeah, so diet does affect, it affects the diversity of microbes that live in our gut. And I think this is a really hot topic because, there's more and more research looking at the gut joint axis, and whether, for example, the foods that we eat can promote inflammation in the gut that results in systemic inflammation. I think eating the diet that I outlined in this talk with a lot of fiber, a diversity of vegetables, especially cruciferous vegetables, and eating those, some of the fermented foods like yogurt, and miso, those are really great strategies for optimizing gut biodiversity. Some people choose to take a probiotic. I think the challenge with probiotics is that there's so much variability in the quality of them. And many of them do not survive the acidity of the stomach. So they don't actually get to the colon, which is where we want them to be. So I think that among people who are considering taking a probiotic, it actually requires a fair amount of research to find a high quality probiotic that is going to even survive the stomach.
Great. I think that's a great segue into thinking a little bit more about what you were discussing in your talk regarding supplements. So I would love it if you could share a bit more specific guidance on how somebody can select a high quality supplement. You mentioned that that's very important to do, but I think a lot of people don't even know how to start going about doing that. So.
Absolutely. Yeah, actually, I'm going to share one other slide here. These are some of the resources that I use when I'm doing research for my patients who are interested. For example, if they come to me and meet with me for the first time and they bring all their supplements and we want to check to see if they're on supplements that are helpful and high quality. This resource, consumerlab.com, is a third-party organization that provides data about all kinds of different supplements to ensure that they're not contaminated with, for example, prescription medications or heavy metals, that they contain what they're supposed to contain. And it also provides some information about interactions with medications. And then another resource is called the Natural Medicines Comprehensive Database, which a lot of physicians have access to through, for example, through our library, but people in the public can access this often as well. So those are a couple of resources that I tend to use.
That's great. Thank you. Are there other supplements? I know you talked about fish oil and omega-3 fatty acids, and then the potential role for anti-inflammatory spices. Are there any other supplements that you recommend to your patients for which there's evidence behind their use, or supplements that you get asked a lot about by patients that you're seeing?
Yeah, I think the indication for adding a supplement really depends on that individual's diet. So, for example, among people who are vegan, sometimes they're not getting very much B12 in their diet, and that's a person for whom it's reasonable to take a B12 supplement. I try to be very judicious about adding supplements since they often aren't covered by insurance. It can get expensive over time, and really just including the ones that are necessary. Because many people with rheumatic conditions take steroids, which can decrease bone density and overall bone health, I'm also often thinking about whether they're getting enough calcium or vitamin D. And so if someone's vitamin D deficient, I always add a vitamin D supplement. And among people who don't eat dairy, I typically include a calcium supplement as well.
Great, super helpful. Someone was asking if you could give a little bit more information about what you said regarding the impact of fish oil potentially on rashes in patients with lupus. They're wondering if there is any known benefit for fish oil supplementation in patients that have other types of skin rashes, such as those related to vasculitis. Do you think it might be beneficial?
Yeah, I haven't come across any studies on the benefit of fish oil for vascular rashes. I think the challenge there is that it's a more rare condition, and so we don't have quite as much data in that patient population. There has been some suggestion that it can be helpful in people with rashes from psoriasis.
Great, thank you. Maybe we'll switch gears and would love to hear from you about other approaches within the realm of integrative medicine that you use as part of a treatment plan for patients. Obviously, it's going to differ from patient to patient, but thinking a little bit outside of the diet world and the supplement world that we've been spending the last 45 minutes in, and thinking about other approaches, would love to learn from you.
Yeah. So I always want to get a sense of how much physical activity an individual is able to engage in, and try to support my patients in becoming as physically active as possible in the context of whatever physical limitations they may have from their condition. And one of the reasons I put so much emphasis on physical activity is because we know that it's helpful, regardless of whether you have a rheumatic condition, for decreasing the risk of things like cardiovascular disease. But there's growing evidence showing that it's also protective for some of the important comorbidities that a lot of people with rheumatic conditions face, such as depression. And that my group has actually been working on looking at whether it influences inflammatory pathways. And we have some recently published data showing that there was decreased expression of inflammatory genes in people who were able to engage in more, at least moderate physical activity. So I think that's one of the big pillars, like nutrition, physical activity, and then thinking about stress and strategies for coping with stress. And that's where the whole field of mind-body medicine comes in, which is kind of a big basket that includes things like a mindfulness practice, forms of mindful movement, such as yoga and Tai Chi. And some of these approaches actually have been studied in people with rheumatic disease and have shown not necessarily to decrease the inflammation itself, but to have really important positive effects on a lot of the symptoms that people deal with, like pain and fatigue.
Great. I've gotten a couple of questions wondering if there are ongoing studies that you're leading or others are leading at UCSF related to any of these approaches of integrative medicine that you've talked about tonight in patients with rheumatic disease. And if there are, how people can find out more to know if they might be eligible to participate.
Yeah, thank you for that question. So with respect to diet, there's a woman named Dr. Monica Guma who is spearheading a randomized controlled trial at the University of California at San Diego that is going to test a Mediterranean diet against an anti-inflammatory diet for people with rheumatoid arthritis. So I think if you Google her name, you might be able to find out about how to get enrolled and potentially participate in that study. I had just mentioned mind-body medicine. And so I will also mention a study that I'm initiating and will be beginning enrollment in 2023, which is a randomized study of a mindfulness intervention for people with rheumatoid arthritis, with the goal to look at the effect that stress and stress resilience interventions, like this program called the Mindfulness-Based Stress Reduction Program, the effect that those things have on symptoms, as well as objectively assess inflammation in people with rheumatoid arthritis. So those are just a couple studies. I think there's going to be more and more studies happening in this space over time.
Great. I think another question that has come up both this evening and in the care of patients on a regular basis is, the vast majority of patients with rheumatic disease are not lucky enough to see somebody like you, who's a rheumatologist who also has such deep knowledge and expertise in integrative medicine and is really able to, take care of them from all angles. So for people that don't have a rheumatologist like you, how do you advise them or suggest that they go about, if they're interested in integrative medicine approaches to health, kind of working with their rheumatologist to focus on those things, or finding other experts to help with those in addition to continuing to see their rheumatologist? How do we all work together to take care of our patients in a better, more holistic way?
Oh, yeah, I love that question. I think broaching it with your rheumatologist is a great place to start, because if you express that you're specifically interested in optimizing nutrition, or connecting with a program to start a mindfulness practice, or becoming more physically active, even if that's not something that's directly within their wheelhouse, they might be able to connect you to the right person to support you on that path. I also recommend visiting the website for the UCSF Osher Center for Integrative Health, because there's many other providers at that clinic in addition to myself. And most importantly, there are community offerings. So for example, the mindfulness-based stress reduction program, which is an 8-week kind of intensive training in mindfulness, which is this practice of cultivating present moment awareness. They offer this class there, and it's offered on Zoom. It used to be in person. I think we'll be having in-person classes again soon. They have yoga classes, and it's a nice place, I think, to connect with some of the resources that are available.
Great, thank you. Well, I think that's a wonderful place for us to end. There are always more and more questions to ask, and I think one thing that I'm taking away from this past hour is we need more studies, and we need more experts like you to help us take excellent care of our patients. Is this showing in slideshow mode or in the presenter mode that it should be showing?
It's in presenter mode.
Okay, thank you. Well, I just want to, first of all, thank you all for spending the last hour with us today. It's really been such a pleasure. I want to acknowledge that this program is supported by the Russell Engelman Rheumatology Research Center and the Division of Rheumatology at UCSF. And I've included QR codes that link to both of our websites there. I want to thank them. And of course, a huge thanks to Dr. Patterson for her time and expertise this evening. And also another thank you to all of you for being here, and hope you found that this session was informative and helpful. You'll hear from us again when the topics and schedule for future programs are finalized, and we'll plan for another session at some point in the spring. If you're interested in learning more about our programs or offering your support, the links are here on this slide. And I've also included a QR code which links to the Osher Center Integrative Rheumatology website. And through here, you can also get to the wonderful resources that Dr. Patterson shared in her talk, focusing not only on nutrition, but all the aspects of integrative rheumatology more broadly. This program, as had been asked earlier, was recorded, and we will be posting it on YouTube within the next few days. So I hope you'll feel free to mention this to friends and family who might not have been able to participate tonight. So have a nice evening, everyone, and thank you again for attending.